Hi, my name is Betsaida Fernandez, and today I will be showing you all how to put on a female Foley catheter. So the first thing I want to do is get my patient's chart and see their physical limitations or non-limitations, and gather all my supplies. Once I've gathered all my supplies, I will perform hand hygiene and put on any personal protective equipment prior to entering the room. So now I will be entering the room and identifying the patient.
Hello.
Hi, my name is Betsaida, and today I'll be your student nurse. So your chart here says that you are scheduled for a Foley catheterization today. So the first thing I'd like to do is check your ID band and make sure I have the right information. Okay, can you tell me your first and last name followed by your birthday?
Maria
Okay, last name?
Salazar.
And your date of birth.
1/1/1913.
Okay, thank you. Now, would you prefer me to refer to you as Maria?
Yes.
Okay. Okay, Maria. So, there will be, regarding the procedure, there will be some discomfort, slight pain. Everyone's different, but I will try to make this as painless and as quick as possible.
Thank you, nurse.
Okay. So let me just close the door and give you a little privacy. Wash my hands and put on my gloves. Can you stop it, please? Okay, now I'm putting on my gloves. All right, Maria. Now that I have on my gloves, I'm just going to put a pad underneath your hips so that we can catch any free-flowing liquids that may fall. Okay. Okay. So what I'm going to do is put that underneath and make sure that you know, nothing gets wet around the area besides the area that we're working with. So if you could be so kind to lift your hips up. Okay. Thank you, thank you, thank you. Okay, just a little bit more. All right. So we have that underneath. I want to put this over you just to give you a little more privacy. Okay. Feel comfortable?
Yes.
Okay. Now, just for time's sake, I'm going to put a few pieces of tape. Oh, we'll just put that later. So, I'm going to get a few bath wipes and just clean your genital area prior to starting the catheterization. Okay. So what I want to do is make sure I grab the outer labias and just clean from topmost down into the anal area. Okay. Okay. We're also going from out to in. And that labia, now that we have everything clean, just gonna cover you right back up just a bit. Okay, now that we have that all cleaned up, my patient still feels comfortable.
Yes.
Okay. I will get my Foley catheterization tray, making sure that it's not expired, used, or damaged. Set that right there on my table. Remove my gloves. perform hand hygiene. And on my clean surface, I would get my clean tray and unpackage it. We're going to use this bag as a little trash bag too. Okay, making sure we are opening this without breaking sterile seal. Okay. Now this clean surface is now our sterile field. And I will be grabbing my sterile gloves and putting them on the clean area that I've made up right here. Now prior to putting on the gloves, I want to make sure that I have my tape ready. Just to secure the Foley in place. Okay. And now donning the gloves. And adjusting. Now that we have that on, I will grab my smaller drape with the shiny part facing downward. I'm going to wrap it around my thumb and index finger. Wrap it over my hands and ask the patient to lift their hips up as I put it right underneath their genital area. If you could please. Okay. Good, thank you. Okay. And now I will extend that sterile area with this blue drape. Also, shiny side going down. If you could please lift your knees up, please. Thank you. Okay, and keep your knees up, please, for me. Just a bit, if you can. Thank you. Okay, we do not need this. And the patient is not allergic to iodine, so we'll be using the iodine in this procedure. Okay. Now I can proceed and move the rest of my supplies over to the bed. Now, what I want to do is put the iodine, over the cotton balls. Okay. And take out a little dot of lubricant onto the tray, and also make sure that my Foley is in working condition and doesn't inflate. So, using my syringe. make sure that this doesn't flap all over the place. And it doesn't inflate. I will disinflate it. Okay, I'm going to put some lubricant on the tip of the Foley and set it aside. Now I'll reach over and get the forceps. And at this point I'll be putting iodine around the genital area. Okay? So now with my left hand I will be using it to touch the genital area. It will not be my clean hand. With the forceps, I will not touch any part of the genital area. Okay? Spreading as wide as possible, I will push the labias outward. Put iodine on one. Iodine through the middle. And on the outer labias. Okay. Now that we have that there, I'm going to reach over and get the catheter, bringing everything with. Okay. My already lubricated catheter is ready to be inserted. I'm just going to bring this over, okay? I will guide it towards the meatus. Okay, this is going to be as quick as possible. I just need you to take a deep breath, one deep breath, and I'll go in quickly. Okay? And I will insert it. Once it is inserted, I'm going to make sure I put it in another 2 to 4 inches and inflate the bubble inside the bladder. Now that that is inside, I'll grab the remaining parts of the catheter. And secure it to the patient's leg, which is determined by the per doctor's orders. Okay? Now that that is in, I can now remove all of my equipment. I can hang this to the side of bed hooks. And remove all the drapings. If you could please lift your eyes up. Thank you. Thank you. Okay. Okay. Are you feeling okay?
Yes.
Okay. I'll remove my gloves. Finish removing the towels. Any towels? Your hips. Return the patient back into a comfortable position. Perform hand hygiene, and that is the procedure. Thank you.